Jessica Edna D'Souza and I work as an ICN in Apollo Hospitals, Bilaspur, and I'm about to tell you about the 5 moments of hand hygiene. The concept of the 5 moments of hand hygiene increases the self-efficacy of a healthcare worker to integrate the importance of hand hygiene into his or her busy schedule at the patient's care. The number 5 is the same as the number of fingers in our hand. It helps us to remember all the 5 moments of hand hygiene. The first moment is before touching a patient. Hand hygiene at this moment prevents the transmission of microorganisms from the environment to the patient through the unclean hands of a healthcare worker. The second moment is before a clean or aseptic procedure. On the patient's zone, a healthcare worker's hand may get contaminated by touching the patient's or the patient's surroundings. Therefore, hand hygiene at this moment is very crucial to prevent healthcare associated infections in the patients. The third moment is after a body fluid exposure risk. After a body fluid exposure risk prevents the healthcare worker from contracting a contagious disease from the patients. The fourth moment is after touching a patient. In a healthcare setup, a healthcare worker has to handle various patients at different points of the duty hours. So after touching a patient, the healthcare worker has to do the hand hygiene to prevent the cross-contamination of diseases and microorganisms from one infected patient to another patient. The fifth moment is after touching a patient's surroundings. After touching a patient's surrounding is important because the patient's surroundings are equally contaminated with disease-causing microorganisms along with the patient's. So, after touching a patient's surroundings, that is the cardiac table, the patient's bed or the IV stand, the healthcare worker needs to perform hand hygiene. So friends, follow the 5 moments of hand hygiene and the 7 steps of hand hygiene and continue to keep your hands free from pathogens and disease-causing organisms and help to improve the patient's condition.